Hello, and welcome to the session, Labor and Childbirth. In this session, we will discuss the 3 stages of childbirth. First stage of labor, early labor, active labor, the transition phase. Second stage of labor, descent of the baby and birth. Third stage of labor, delivery of the placenta. The first stage consists in the thinning and opening of the cervix and has 3 phases. It may be hard to differentiate between early labor and the preparatory labor. It is often only when we are getting closer to active labor that the distinction becomes possible. Contractions are rhythmic, and they become more intense and closer together. The pain can be similar to menstrual pain and can be felt in the lower back. The frequency, duration, and intensity may vary depending on the position. The early labor is the longest phase in childbirth and can last as long as 24 hours. This is why it is better to go through that phase at home. You can keep engaging in your regular activities with a peace of mind while you focus on pleasant things. Keep eating, relaxing, and sleeping, so you preserve all the energy required for the next phases of childbirth. At the end of early labor, the cervix will be dilated to 3 or 4 centimeters. Keep in mind the 5-1-1 rule that we saw during the last session, the start of labor. We wait for the contractions to become more painful, happen every 5 minutes and last 1 minute, and be that way for at least 1 hour before leaving for the hospital. However, regardless of your contractions, when the membranes rupture, you must leave for the hospital and follow the recommendations issued during the session on the start of labor. Here are some pieces of advice regarding the start of labor. At night, you can take a warm bath. Since your membranes are not ruptured, it is okay to use bath foam or oil. Try to rest as much as possible and to sleep between contractions. Stay hydrated and eat according to your needs. During the day, continue your activities and focus on things that you enjoy. Having someone with you may help. It is important that you have a close relationship with the person chosen. That person will need to respect your rhythm and your needs. Relax, take naps, save your energy, let your body work. Breathing often takes an important place in the future parents' minds. This is probably due to the representation of childbirth in movies, which show us women breathing in various ways. However, there is no right or wrong way to breathe when giving birth. The only important thing is to breathe. It is especially important not to cut your breath, as you and the baby both need oxygen. The use of relaxation and breathing techniques is associated with a lower intensity in perceived pain. Some women use slow breathing during contractions. It can help you focus and it can help you relax. Take a deep breath through the nose and exhale slowly through the mouth. Inhale calm and exhale tension. The rhythm should come to you naturally. Return to your regular breathing when contractions are over. The person who is with you can help by reminding and encouraging you to breathe. They can also breathe with you for a moment and to make sure that you do not hyperventilate. Relaxation during labor can be achieved in different ways. Breathing and visualization techniques can help women relax and increase their feeling of being in control. Some women visualize the opening of their cervix and the descent of their baby. Some will relieve tensions in their body when they exhale. Others will recall inspiring sentences that they have read during the preparation of childbirth. The important thing is to focus on anything other than the contractions in order to decrease the pain. If your partner is present, their role is important. Because they know you well, they will be able to support you and comfort you with all of their love. They will help you put things into perspective, to unwind, to save your energy, and to relax. They will remind you to stay hydrated, to eat according to your needs, and to take naps. Active labor will bring the dilation of your cervix up to 10 centimeters. In that period, the body is working hard. Many sensations may accompany the pain you feel during childbirth: heat, cold, feeling of being in contact with the baby's descent. The active phase lasts approximately 6 hours for a first baby after well-sustained labor. Contractions increase in frequency and get more intense, going from a 5-minute to a 3-minute interval. The spontaneous rupture of membranes often happens during this phase. It is important to stay in the moment and to handle contractions one at a time. Just as in the previous phase, breathing can be used as a tool to help you remain in control during contractions. Start with slow breathing, and the breathing will come faster when the contractions become more intense. Follow your own rhythm. The important thing is not to cut your breath. Be active as long as possible during labor. You will feel like you are more in control of your childbirth. That will let you experience childbirth more positively instead of suffering through it. A standing position leads to more effective uterine contractions, which means reduced labor time and easier descent for the baby. That position is also associated with a reduction in the pain felt, better maternal fetal circulation, and better fetal oxygenation. Here are a few examples of standing positions. Leaning forwards offers good positioning for the baby. The pelvic tilt relieves the back and helps with engagement. If suspension is possible at the hospital, this position lengthens the spine and gives room for the baby. When contractions become more intense or when fatigue sets in, kneeling positions where you support yourself with your hands can be comfortable. Here are a few examples. Being on all fours is one of the more physiologically effective positions for labor and childbirth. It provides easy access to the back for massages, pressure points, and applying heat. Having a round back, cat's back, favors good positioning and helps with the baby's descent. Various tools may be provided to you, such as an exercise ball. You can sit on it and move at the same time, which helps you staying mobile during contractions. If no one offered this, do not hesitate to ask for it. There are only a few possible positions. Trust your instincts and take the position that seems to be the most comfortable for you at the time. Calming touch, effleurage, pressure points, and petrissage are all components of massage. Massage brings relaxation and reduces pain, which in return leads to a higher endorphin level and a lower anxiety level. Massages can also be a way for your partner or future father to communicate their support, encouragement, and empathy, and can bring the woman giving birth to the feeling of security. Warm compresses can be applied to the back, to the lower abdomen, and to the perineum. In addition to relieving pain, heat reduces shivering and trembling, joint tension, and muscle spasms. It increases the flexibility and the stretch of conjunctive tissues. Cold compresses can be applied to the back, the neck, the chest, and the face. In addition to decreasing the perception of pain, cold helps relieve muscle spasms and reduces inflammation and swelling. It is important to consider that some women do not like to be touched or prefer some other form of touch during labor. It is important to listen to your needs and respect them. For many women, being in water also helps manage the pain. The heat that comes from being in the water gives the comforting feeling of being enveloped, protected, and relaxed by the water. Immersion in the water also gives the impression of entering a bubble, creating the feeling of privacy and control, which leads to greater abandon. During the transition phase, you will have your most intense moments. Contractions become closer and longer, in order to dilate the last few remaining centimeters of the cervix. This is often the hardest phase, but it is also the shortest. You may feel various sensations such as a faint feeling of having to use the toilet, a pressure, pain in the lower abdomen, the hips, and the back. This is the baby descending. Remember to think about your baby. Visualize the cervix opening. Release all tension. Keep focusing on your breath. Contractions are a part of you. You will benefit from receiving encouraging words. Let us now say a few words to the future father or partner. You have a very important role to play during childbirth. You will need to keep a calm and loving attitude. Trust the staff and ask your questions. Your trust is communicative, and so are your fears. Take care of yourself. Breathe, stretch, etc. If you start feeling uneasy or dizzy, let a staff member know. Say few words, but be very present. Try not to talk during contractions because she needs to concentrate. Preserve the bubble. Handle visitors. Take the phone calls. Give her water. Apply cold compresses. Listen to her and encourage her. Rub, massage, and caress her with your hands. When your cervix is dilated to 10 centimeters, the second stage of labor begins. When the time to start pushing has come, sensations transform. Uterine activity usually pauses for a short moment. Contractions are strong, but felt differently. Finally, you can push when you feel a contraction. 3 to 5 minutes can now pass between each contraction. Use these pauses to rest and recover. When the contraction happens, take a deep breath and hold your breath while you push. Then return to a regular breath. The staff will be there to guide you. You can take one of many positions for pushing. Here are a few suggestions. Lying on your back may be put off until the professional sees the baby's hair. Before that moment, you can change positions. Discuss this with your physician. You can also include it in your birth plan. Keep a positive attitude when pushing. You will soon be meeting your baby. To help with pushing, you can stay hydrated, encourage yourself out loud with nice words, empty your bladder, change positions often, touch your baby, look at the progression using a mirror. Together, let's look at the photos of the progression and birth of a baby. These images illustrate the stretching of the perineum. Vernix is a waxy white substance produced by the sebaceous glands that covers and protects the newborn's skin. It protects the fetus's skin from the aqueous uterine environment. After birth, it does not have to be wiped off. The baby's skin will absorb it. You finally hold your little treasure in your arms, but childbirth is not over. The third stage is starting. The third stage consists in the delivery of the placenta. This stage often goes unnoticed because your baby has all of your attention. Uterine contractions continue to allow the placenta to separate from the wall of the uterus and be delivered. However, these contractions are felt less painful by the majority of women. Then, after the delivery of the placenta, your uterus will keep contracting in order to avoid hemorrhages and to return to its initial shape. You may feel these uterine contractions for a few days. The first few hours of your baby's life are a perfect time for skin-to-skin contact. Skin-to-skin protects the security bubble created by the high oxytocin levels. These are now at the highest level they will be in your whole life. This helps reduce the risks of complications that may occur during the third stage of labor. Skin-to-skin favors the production of several hormones that, when acting together, favors the bond between the mother and the baby and lead to, among other things, awareness from the baby, a certain euphoria in the mother, and preparation for breastfeeding. In the first few hours, days, and weeks of life, the mother and father can practice skin-to-skin contact as often as they like. Simply place the baby, wearing only a diaper and covered by a blanket, directly on your chest. Frequent skin-to-skin contact is important in all babies, especially those who cry a lot, or are premature or asleep, and even more when breastfeeding is difficult. It increases the baby's feeling of safety. It stabilizes its temperature, breathing, heart rate, and blood sugar. It reduces the frequency of crying and agitation episodes. It reduces the pain felt during painful procedures. It initiates the parent-child bond. It makes the start of breastfeeding easier. For parents, skin-to-skin contact helps create and maintain a deep and solid bond, reduces stress, and favors the parent's sleep. Lets the parents discover their baby and recognize its needs more easily. Increases parental confidence. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.